Assalamu alaikum everybody. I hope that you are in good health and prosperity. Welcome back to my principles of pharmacology, where we'll continue talking about drugs which are used in treatment of mental disorder. This is the third presentation, which discusses the benzodiazepines pharmacodynamics. In the previous presentation, we discussed the benzodiazepines pharmacokinetics, and today we'll discuss the benzodiazepines pharmacodynamics plus the pharmacodynamics of non-benzodiazepines anxiolytics. So the main goal of this presentation is to know what are the pharmacodynamics of benzodiazepines, including their mechanism of action through the GABAA system and how they act as allosteric agonists. Then we'll talk about the pharmacological actions, including sedation, hypnosis, anxiolytic action, and skeletal muscle relaxant effect. Then we'll talk about the side effects and how they are extension of the pharmacological action. And lastly, we'll talk about the tolerance and dependence to this group of drugs and how to treat them. We'll talk as well about the pharmacodynamics of non-benzodiazepines, including azapirones, and lastly, we'll talk about the clinical application or clinical therapy of anxiety disorders in general. So first, we are going to talk about the pharmacodynamics of the benzodiazepines, and we will start with the mechanisms of actions, how they produce their action. In benzodiazepines, as we know, they act through the GABAA receptors. And the GABAA receptors, they are pentameric ionotropic receptors. What does it mean, pentameric? It means that they are formed from 5 subunits, as you can see here. 2 alpha subunits, 2 beta subunits, and gamma subunits. These 5 subunits, they surround the chloride channel. That's why it's known as ionotropic. Ionotropic because these units, they surround the chloride channel, okay? At rest, this chloride channel is closed. So this is the GABA macromolecule, and this is the neuronal membrane, okay? This is the GABA-A receptors. The GABA-A receptors, they have different binding sites. They have different binding sites. The original binding sites to which GABA binds, which are present on the alpha and beta subunits, these binding sites, they are known as orthosteric binding site. Orthosteric binding site. You have the orthosteric binding sites. They are receptors for the GABA and GABA-like drugs. Okay. Now, once GABA binds to its receptor, what will happen? Chloride يحصل change in the configuration of the receptor in a way that chloride channel will open, okay? Now, once chloride channel opens, as we know, chloride is concentrated outside the neuron. It will rush into the neuron, increasing the negativity of the intracellular membrane. This will result in what's known as hyperpolarization. Hyperpolarization. And we know that hyperpolarization, more negatively charged membrane, will result in neuronal inhibition. Neuronal inhibition. That means neuron inhibition, central nervous system depression. Okay. Yep, this is the first. GABA will bind to specific, which is the GABA, of course, is the gamma aminobutyric acid, which is known as gamma aminobutyric acid. Once it binds to its receptor, chloride channel will open and chloride will cause hyperpolarization or inhibition. Okay, so this is the first binding sites, orthosteric binding sites for GABA-like drugs. GABA macromolecules, this is the GABA macromolecules, it contains other binding sites. They bind other drugs other than the GABA. These binding sites, many actually, these binding sites, they are known as allosteric binding site. Allosteric binding sites. Allosteric. This allosteric might be a barbiturate receptor or they might be a benzodiazepine receptor. Benzodiazepine receptors. The benzodiazepines here where they act. They act on specific benzodiazepine receptors. They are known as allosteric binding site. Benzodiazepines, once they bind to these receptors, they produce an action as you will see later, okay? I have to say here that the alpha subunit, this alpha, which is a protein, of course, an alpha subunit is a protein. In alpha subunits, there are 5 different types. Alpha subunits, there are 5 different types. Alpha 1, alpha 2, alpha 3, and alpha 5. This is which we have to know. Alpha, different types. How they differ these from each other? The alpha subtypes, how they differ from each other? They differ in structure, function, and location, of course. They differ in structure and function and location. They found that if alpha 1, the binding sites on the alpha 1 is stimulated, this will lead to sedation and ataxia and hypnosis. While if alpha 2 alpha 3 alpha 5 subunits are stimulated, this will lead to anxiolytic action. Okay, يبقى alpha subtypes, are they the same or they are different? They are different. There are 4 different types: alpha 1, alpha 2, alpha 3, and alpha 5. How they differ from each other? They differ in structure, function, and place or location. Okay, now benzodiazepines, they act on 2 different types of receptor. Benzodiazepines, they act on 2 types of receptor. One is known as benzodiazepine 1 receptor. Benzodiazepine 1 receptor. This is mainly alpha 1 unit. It contains mainly alpha 1 unit. And stimulation of this receptor by a benzodiazepine will result in hypnosis and ataxia, of course. Will start sedation and hypnosis. This is true for zolpidem, this drug. Zolpidem. This drug, zolpidem, is the benzodiazepine 1 agonist. Once it binds to its own receptor on the alpha 1 subunit, it will result in hypnosis. Okay, yeah, this is the first type. The second type is known as benzodiazepine 2 receptors. Benzodiazepine 2 receptors. With benzodiazepine 2 receptors, it is formed from alpha 2, alpha 3, and alpha 5 subunits. Okay, yep, the benzodiazepine 2 receptors, they are formed from alpha 2, alpha 3, and alpha 5, either of them, alpha 2, alpha 3, or alpha 5. All these benzodiazepines, if they are stimulated, it will lead to anxiolytic action. It will lead to anxiolytic action. Okay? Okay? Now, so the benzodiazepines, they act on both receptors. The normal benzodiazepines we are going to talk about in this presentation, they act as an agonist or allosteric agonist, positive allosteric agonist, or at both receptors. Positive, allosteric, positive, that means they produce a positive effect. Positive allosteric agonists. They act as a positive allosteric agonist at benzodiazepine 1 and benzodiazepine 2. So in this case, what will happen? All action. They produce sedation and hypnosis, and as well they produce anxiolytic effect. Okay? Okay. Now, so how the benzodiazepines, they produce inhibition, how they produce hypnosis, anxiolytic action, how they do that. As we have said, GABA, when it binds to its receptor, it will lead to opening of chloride channel, or chloride will cause hyperpolarization of the membrane, i.e. inhibition. Okay? Now, what the benzodiazepine do? First, once they bind to the receptors, once they bind to their own receptor, whether they are benzodiazepine 1 or benzodiazepine 2, they will increase the frequency of chloride channel opening. They increase the frequency. They increase the frequency. This is very important. They increase the frequency of chloride channel opening. يعني النمبر of opening of chloride channel due to GABA will be increased. في الحالة هذه what will happen؟ معناها more hyperpolarization، معناها more إيش؟ inhibition. So this is how they produce their depressant effect on the central nervous system. Okay? يبقى benzodiazepines, I say it again, benzodiazepines, once they bind to their own receptor, which are allosteric binding site, they will increase the frequency of chloride channel opening. The opening will be increased. This means more hyperpolarization, معناها more inhibition. This effect will happen only in the presence of GABA. We have to make sure about that. It happens only in the presence of GABA. If GABA is absent, benzodiazepines will have no effect. If GABA is not present, endogenous GABA, and GABA in the brain, which is sensitized in the brain, it is a natural neurotransmitter. Benzodiazepines will act only in the presence of GABA. If GABA is absent, benzodiazepine will do nothing. That's why benzodiazepines are more selective in their effect. More selective in their effect. شو معناها more selective than barbiturates, for example? Then, as we have said before, when we talked about barbiturates, we said that barbiturates on their own, they can cause opening of chloride channel. That's why they can produce loss of consciousness in high doses. Benzodiazepines is the opposite. They can never produce by their own. Yani if they are not taken with another drugs, they can never produce loss of consciousness. Loss of consciousness. Never consciousness. Loss of consciousness. Why they never produce loss of consciousness? Because their effect is limited by the endogenous GABA. If the GABA is producing action and it is present, they will increase the number of frequency. If GABA is not present, they produce no effect. واضح الكلام؟ يبقى this is how benzodiazepines they produce their action. They produce their action through the GABA system. So what are the action produced by the benzo? So we said that they produce their action through the GABA-A receptor by acting as allosteric agonist, positive allosteric agonist at the benzodiazepine receptors. They do that on different parts of the brain, including the brainstem, especially a reticular activating system, which we talked about before, and we said that this reticular activating system is important to maintain awakeness or consciousness. So this will be affected by the benzodiazepines, and therefore the person will get sedated and sleep. Also, they affected diencephalon. With diencephalon, as we have described before, is a part of the limbic system. And we have said that the diencephalon is important in regulating mood of the person and aggression, and therefore their effect on the diencephalon will decrease aggression. Also, they will affect cerebral cortex. With cerebral cortex, as we have explained before, where all higher mental activity takes place. Therefore, functionally, they will produce CNS depression, which is responsible for their action, for all their action. So what are the actions? Their action, first, their action on animals. Usually, if we inject a benzodiazepine to an animal, the animal will become very calm. A benzodiazepine will reduce aggression, Animal becomes less aggressive. And this is one of the use of the animal. Of course, plus sedation, plus decrease in motor activity. This is in animals, sedation plus inhibition of motor activity. Very characteristic effect on animals. Okay, this is first. Also, they produce anxiolytic effect in animals by inhibiting the suppressive effect of punishment. For example, in the plus maze or open field test. So they can produce anxiolytic effect in certain types of experiment like plus maze. طبعا this is out of the scope of our presentation. المهم what we should know ان they produce a calming effect in animals by decreasing aggression, they produce sedation, inhibition of motor activity, and as well they produce anxiolytic effect, which can be measured in punishment or suppression effects of punishment. So in humans, they produce dose-dependent effect. In small doses, they can produce anxiolytic effect. This anxiolytic effect اللي هو الفيلينج of calm and sedation, usually as accompanied by euphoria. Euphoria, feeling of well-being, feeling of happy. Usually, this euphoria is the main cause of dependence on this group of drugs, as we will see in a few minutes. Okay, you have that in small doses, they can produce anti-anxiety effect. This anti-anxiety effect, the person will become calm with reducing aggression, and this can happens in low doses with feeling of euphoria. If we increase the dose, they can produce sedation and hypnosis. A person can go to sleep, sedation and hypnosis. And that's why we usually, in short-acting benzodiazepines, they are preferred as hypnotics. Short-acting benzodiazepines, they are used as hypnotics. For example, midazolam, triazolam, etc. Okay, alprazolam. These drugs that are used as hypnotics. A third action, they have an anticonvulsant effect. Anticonvulsant effect. Anticonvulsant, that means they can prevent convulsion, الاختلاجات, which is known as in humans as epilepsy. Epilepsy, الصرع, epilepsy. Yep, that they have very important place in the treatment of certain types of epilepsy. For example, diazepam is a drug of choice in treatment of status epilepticus, اللي هي continuous attack of epilepsy, status epilepticus. It is given by intravenous route for treatment of status epilepticus, which is a continuous attack of epilepsy. Okay, of course, this is very damaging to the brain and can kill the person if not treated. Clonazepam, for example, is used for petite mal epilepsy. Clonazepam is used for treatment of petite mal epilepsy. Inshallah, when we talk about the epilepsy, we know that there are different types of epilepsy, including petite mal, grand mal, status epilepticus, etc. Okay, they can produce muscle relaxant effect. All these are pharmacological action and clinical application, of course. Muscle relaxant effect. They can induce skeletal muscle relaxation. They do that by inhibiting the polysynaptic reflexes in the spinal cord. Therefore, they are used to treat certain types of rigidity, especially due to what's known as cerebral palsy. Cerebral palsy, or damage to the brain. Yet they are used for certain types of muscle rigidity, skeletal muscle rigidity in patients with cerebral palsy. Okay? Yet these are most important pharmacological action. They have very little effect on other organs of the body, except that they have very little effect on the microsomal enzymes. Microsomal enzymes. يعني they do not induce the microsomal enzymes. They do not produce microsomal enzymes. So these are the benzodiazepines. They can induce anxiolytic effect, sedative effect, anticonvulsant effect, and muscle relaxant effect. On other organs, they have little effect. So what are the side effects? Of course, as we have explained several times before, no drug without a side effect. So what are the side effects induced by the benzodiazepines. Of course, the side effects, they are extension to their pharmacological action. They are extension to their pharmacological. So we expect that these side effects are modest usually and depends on the dose. So the main side effects including sedation, of course. If we want muscle relaxant effects, for example, then we expect that sedation will take place. They can produce dizziness, they can be reduced, of course, due to muscle relaxation, muscle incoordination. These will produce what's known as ataxia or staggering gait. Ataxia. يبقى الاتاكسيا اللي هو staggering gait due to defect in muscle coordination. They can produce paradoxical agitation, and this is a problem. Paradoxical agitation, where the patient will become hostile and aggressive in his behavior. Usually, this is more when it is taken with alcohol. This paradoxical agitation, in which the patient becomes hostile or aggressive, usually is known as behavioral disinhibition. Behavioral disinhibition, behavioral disinhibition. We talked about this disinhibition when we talked about the general anesthetics, okay? All the side effects related to the benzodiazepines, they are related to the or extension of the pharmacological action. We have to know that, of course, if they produce muscle relaxation and they produce sedation, dizziness, and in this case, the person should avoid driving cars or other moving machinery. Okay? So these are the major side effects of benzodiazepines. The benzodiazepines, the problem arise when they were discovered, they were used on a large scale to discover lately that they can produce very dangerous tolerance and physical dependence. Tolerance and physical dependence. With tolerance, as we have said, physical dependence. Tolerance means that the patient has to increase the dose to get the same effect. This is tolerance, to increase the dose to get the same effect. This tolerance is said to be central in the central nervous system. يحصل central adaptation to the effect of the drug in the brain. Yet in this case, the patient has to increase the dose, and every time he increases the dose, he will get, of course, more side effects. The physical dependence, that means that the patient will become dependent on the drug. Yani he cannot survive without the drug. Usually this physical dependence takes place with very large doses and for a long period of time. يعني عكس الباربيتوريتس. Barbiturates, they produce physical dependence in very short period of time, maybe a week. And the opioids, of course, morphine-like drugs, they can produce physical dependence within a week or so. These drugs, to produce physical dependence, it will take a very long period of time, usually months, and as well large doses. Like once they happen, if the physical dependence happens, this is very dangerous. It's very dangerous. Why? Because if we stop the drug, withdrawal symptom will take place. What's known as withdrawal symptoms. Well, withdrawal is dangerous. Withdrawal is dangerous. What will happen in this case? Withdrawal is dangerous. What are the withdrawal syndrome? Depends on three factors. Depends on the dose of the drug taken, depends on the duration of the intake, and depends on the potency of the drug. Some drugs, especially the new novel benzodiazepines, which are known as street drugs, they are sensitized illegally by external laboratories for illegal use. Usually, they are highly potent benzodiazepines, and these are the most dangerous nowadays. If the dose is low and duration is short, of course, then I will see minor withdrawal syndromes. These minor withdrawal syndromes consist of anxiety. طبعا his anxiety will become worse before treatment and after stopping the drug. هو طبعا insomnia, it is the opposite to the initial effect. Anxiety, insomnia, and he might suffer from severe nightmares. طبعا this will make the person go back to the benzodiazepines, and of course he will increase the dose if he's not getting the same effect. And by increasing the dose for a long period of time, he might get a major withdrawal symptoms. If he stops taking the drug, he might get a major withdrawal symptom. And this is the most dangerous. This is the most dangerous. Why? Because it is life-threatening. It is life-threatening. It can kill the person. It can kill the person. So major side effects, why they are dangerous? Because they are life-threatening. They can kill the person if not treated properly. Threatening. Okay? So in this case, what will happen? Different symptoms will take place, which depends on the dose and duration. First, يحصل perceptual disturbances. Perceptual disturbances. It is called a kind of hallucination and maybe delusions. Also, he might get a psychotic reaction, psychotic-like reaction, psychosis, like hallucination, like delusion. His body temperature will increase, and this will produce what's known as hyperpyrexia. Hyperpyrexia, increase in body temperature. طبعا beside an anxiety والinsomnia والnightmares, he might get perceptual disturbances, including psychosis, hyperpyrexia, and in the end, the patient can enter into convulsions, والconvulsions of course can lead to death. يخش في صرع، والصرع هذا ممكن ينتج عنه الموت. Okay? يبقى these major withdrawal symptoms due to benzodiazepines, they are very dangerous and should be treated in special centers. Okay? And usually this takes place when the benzodiazepines, especially the novel benzodiazepines, which are illegal street drugs, and usually they are highly potent. Okay? يبدأ how we can treat withdrawal syndromes, how we can treat withdrawal symptoms. They treat them according to the dose taken and according to the drug taken. If there is convulsion, of course, they have to treat convulsion by giving diazepam, for example, which is a benzodiazepine. Okay? And then they give the drug which were taken and slowly reducing the dose. They give the drug back, they start giving the drug back and slowly reducing the dose. You have the treatment of dependence. This should usually it is done in specific centers. They give benzodiazepine, especially they give benzodiazepines, especially intermediate acting benzodiazepines, and they slowly taper the dose. They slowly decrease. يسمى dose tapering. They slowly decrease the dose until maybe it take months. Decrease the dose slowly. This process will take months of therapy. Okay? So these are the benzodiazepines, their effect, their clinical use, their tolerance, and physical dependence. The second group are the non-benzodiazepines anxiolytics. Yeah, we talked about the benzodiazepines, anxiolytics. And now we'll talk about the non-benzodiazepine anxiolytics. You have the second group, non-benzodiazepine anxiolytics. This group, they act on different types of receptor. They are not related to GABA. They act on different types of receptor. The most famous are the azabirons. Azabirons, the group. The most famous is busbiron, ipsabiron, G-biron, and others. Okay, if these are the second group, anxiolytics, they are non-benzodiazepines, like azabirons, including the busbiron, the ipsabiron, and G-biron. These are different from the benzodiazepines in the mechanism of action and in the action as well. So how they act? They act as an agonist at 5-HT1A receptor. How they produce their action? They act as an agonist. Though I'm talking about the mechanisms of action, they act as an agonist on 5-hydroxytryptamine type 1A receptor. 5-hydroxytryptamine, which is serotonin. Okay? You have that they act as specific agonist at 5-HT1A receptor. Also, they can decrease the potassium conductance. They decrease the potassium conductance. Well, potassium, as we know, is inhibitory. They decrease the potassium conductance. And this decrease in potassium conductance will lead to hyperpolarization of the neuron. Well, hyperpolarization, we said this is what? Inhibition. So this is how they act. They act on certain 5-HT1A receptor and by decreasing the potassium conductance. These drugs, azabiron, G-biron, these drugs, they have a slow onset of action. They have very slow. This is a disadvantage. A slow onset of action. شو معناها? What does it mean? Means that the therapeutic effect will start only after weeks of treatment. Therapeutic effect مثلا أنا نبي anxiolytic effect. An anxiolytic effect will take weeks to develop. Takes weeks to develop. يعني لو البيشنت ياخذ drug today, it will take 3 to 4 weeks before he can get any benefit effect, before any relief of his anxiety. Okay. Of course, this is disadvantage of this group of drugs. لكن more advantage of this group إن they don't produce any tolerance or dependence. They produce no tolerance or dependence, which is a good effect. يعني عكس البنزودايزابينز. Benzodiazepines, they produce tolerance and dependence. These drugs, they produce no tolerance or dependence. فبالتالي what you expect ان they produce no withdrawal potential. يعني if I stop the drug, there will be no dangerous withdrawal consequences. Okay. Of course, they produce very minimal side effects. Usually, they can produce dizziness or nausea, especially at the beginning of therapy. So these are the non-benzodiazepine anxiolytics. Non-benzodiazepine anxiolytics. Okay. And last thing I'm going to talk to you about is the benzodiazepine antagonist. Benzodiazepine antagonist. We talked about the benzodiazepine agonist, and now we'll talk about the benzodiazepine antagonist. This drug usually, they act as a receptor blocker. They act as a competitive antagonist. يعني they block the receptor, competitive antagonist at the benzodiazepine receptor. يعني they don't act as allosteric agonist, positive allosteric agonist. They act as antagonists. They sit in the receptor and prevent the access of benzodiazepines to these receptors. The most famous is flumazenil. 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 Flumazenil is a competitive antagonist at the benzodiazepine receptors. Usually, this acts as a competitive antagonist, as we said, for both pure agonist, positive allosteric, or negative allosteric agonist as well. What's the use of this drug? So this drug is used clinically to treat benzodiazepine overdose toxicity. Okay, this is first. They can be used to treat benzodiazepine overdose toxicity. Second clinical use is to reverse rapidly benzodiazepine effects. مثلا واحد دخل الاندوسكوبي ولا gastroscopy, they are given benzodiazepines to calm the patient so that an endoscopy can be done easily. Okay, so in this case, if they want to reverse the effect of benzodiazepines, the patient is given flumazenil so that he can be discharged quickly from the hospital. This is the benzodiazepine antagonist. Okay. Lastly, we'll talk about therapeutic uses of benzodiazepines. Benzodiazepines, nowadays they are no longer considered to be first-line monotherapy. Why? Because of the problem of tolerance and dependence. ولكن they are kept only for certain cases. They are kept only for certain cases where indicated for a short period of time under very close medical supervision. Okay. Now, the drug of choice, of course, as I have said before, are the selective serotonin reuptake inhibitors with selective noradrenaline reuptake inhibitors. Okay. This is first. The therapeutic uses of benzodiazepines in treatment of anxiety become less. They are not. They are no longer considered to be first-line treatment. Why? Because of the problem of dependence and tolerance. Therefore, they might be used for a very short period of time, the lowest dose possible, under very close medical supervision. Of course, the benzodiazepine should be used very carefully in children and old age. Also, they should not be taken completely. They are absolutely contraindicated with other CNS depressants like alcohol and opiates or morphine-like drugs. They are completely contraindicated with alcohol and other CNS depressants like opioids. Why? Because in this case, it can lead to fatal loss of consciousness because of the potentiation of the effect between benzodiazepines and these drugs. So, in summary of our presentation, we said that the benzodiazepines, they act through the GABAA receptor, where they act as allosteric agonist on the benzodiazepine receptors, and by this action, by And by this mechanism, they produce different action, including anxiolytic effect. At small doses, they can produce sedation and hypnosis. Also, they have a muscle relaxant effect and as well anti-epileptic effect. We spoke about the side effects of the benzodiazepines, and we have said that these side effects are extension of the pharmacological action. We said that they can produce tolerance and dependence. This dependence usually is physical in nature and dangerous in case of taking the benzodiazepines in high doses for a long period of time. We talked as well about the non-benzodiazepine anxiolytics, especially azabirons. So I hope that you enjoyed this presentation and hope to see you again in my next presentation. Thank you very much for your attention, and I'll say Assalamu alaikum wa rahmatullah. شكرا لكم على حسن الاستماع. الرجاء لا تنسوا الاشتراك في القناة، الإعجاب، التعليق والمشاركة مع الزملاء. دمتم بخير وعافية، والسلام عليكم ورحمة الله.